and we'll get going. And welcome to everybody who's here. Do we have any apologies?
Yes, Jyoti Attry, George Bramaliko and Alice Kunjapi-Clifton.
Thank you. So we've got the minutes of the previous meeting. Has anyone got any comment on those? Seem very good and so on. So, okay. I don't think we've got any public questions. No town and parish council questions, and no councillor questions. So, okay, thank you very much. So we can go on to the alcohol, drugs and tobacco vaping piece. Karen's going to introduce this, but looking at it, I was personally horrified by the fact that 38% of 15-year-old boys and 20% of 15-year-old girls drink 15 or more units of alcohol per week. And that shocked me, to be quite honest. I had a dear friend who, she was an alcoholic, and she died on the first day that her youngest son went to school from alcohol poisoning. And, you know, it hit when things like that happen, it does hit you. So I think, you know, this is a very important thing that we need to make sure, you know, people know about the dangers of things like alcohol and tobacco. So Karen, I believe you're introducing this.
Yeah, thank you, David. Thanks for the introduction. And as you say, it's sometimes it's a stark read, isn't it, when you look at the data and you remind yourselves of how prevalent these behaviours are. So today we're here to seek the board's approval for the alcohol, drug, tobacco, vaping needs assessment, and that will be published onto the Berkshire Observatory. And that's the very detailed data pack that you've got. And then the second ask of the board today is to approve the alcohol, drug, tobacco, vaping strategy for Wokingham. And that's a 9-page strategy into action, clearly setting out our ambitions as a partnership to take forward that work. The strategy considers national policy and strategy, so it considers the 10-year drug strategy and also helps to realise the smoke-free generation ambitions locally. It's connected to the council plan, particularly around fair, connected and safe, and really links into our Marmot ambitions, thinking about how everyone can thrive, and particularly thinking about reducing inequalities and how those building blocks apply in the alcohol, drug, tobacco, vaping space, to think about their role in preventing alcohol, drug, tobacco, vaping use, also their role in the treatment and the recovery. For that to be successful, we need to consider those building blocks. So it's really thought about that across the partnership and across stakeholders. The other key thing to note is the change in governance. Slight change in the governance. So we have a well-established action group, and that's across different sectors that have worked to deliver on this. And what we really need, I guess, is a steering group of strategic partners to really hold us to account in delivering that work. So we are setting that up with key partners. And that's not just the Wokingham strategy today, but also thinking about the wider Berkshire Combating Drugs Partnership, the Berkshire West Tobacco Control Alliance work, as well as other ICB police. Thames Valley Police are doing a drug strategy. So it's really making sure that's meaningful for Wokingham in a kind of neater structure. And I think that'll be helpful for us as in giving clarity to you as a board as well going forward. The vision is very much about collaboration, compassion, community. And then I was just going to summarise some of the other, I guess, key statistics in there. So 80% of our adults drink alcohol nationally. And as David mentioned, we have a high proportion of young children who are drinking 15 or more units of alcohol per week. It is important to note that although there is this prevalent behaviour and a universal behaviour around alcohol, few require specialist treatment support. However, when those numbers do reach our specialist drug and alcohol support services, they are likely to be in touch with other system and council partners. To put that into context, we have around 187 adults in treatment for alcohol and 272 adults in treatment for drug use. So they are small numbers, but I think we can have real meaningful impact jointly to think about that. And 45 under the age of 18 years for drug and alcohol support. When we look at smoking, we're looking pretty good. We have been at 5% as a borough, close to 5% in terms of being smoke-free, so only 5% to 6% smoking, 4.3% in pregnancy. But again, we know that there are inequalities. So those who choose to have or go into careers in routine and manual occupations, 18.7% smoke. And for those who have long-term mental health, that increases to 20.1%, so 1 in 5. Youth vaping, we also know, is on the rise nationally, and I think there's much more work that we can do locally to think about that. So we've done a lot of creative work with schools, but I think we need to get a better data picture on that. When we think about our surroundings, our crime rates related to drug and alcohol are low, but they're still there. We need to get a better picture around the illegal underage sales locally. We have 316 drug or drink-related driving occurrences happening in the previous year. We have a higher proportion of homeless households locally having a drug dependency. Big caveat there is obviously they are small numbers. When we look at our children in need assessments, 13% have parental alcohol use as an identified factor, 8% is parental drug use. So again, it really highlights that need for prevention and joined up approach in terms of how we break these cycles and this generational patterns. 125 of those in our drug and alcohol treatment use are parents, and a high proportion have a history of domestic abuse. When we look at school exclusions locally, again, it's very small numbers, which is always the caveat here, but drug and alcohol use is a common reason for school exclusions locally compared to other areas. And when we look at the work building block, we have a high number in work, but of course, these numbers are still low. When we think about what we are going to do, I guess there's just a few things to highlight. So one is around data, really working with partners to understand the why. And I know we've got Jason coming on around the CSP. So really thinking about why, the causes, and then working together as a system to think about preventing that. So it isn't always necessarily that the people who are in our system, there's work to do there. There's also thinking about the patterns to think about how we prevent people coming into the system in the future. We need to have more structured learning around our drug-related deaths, but also thinking about domestic homicide reviews and safeguarding reviews where alcohol or drugs is a factor, and really structuring that in a more systematic way locally. There is children and families work, again, thinking about prevention, linking into the helping early and the best start in life work. Accepting that the reality is that some people will be addicted to drugs and alcohol. That unfortunately is the reality for some once they are in that position, and so really being clear about the harm reduction methodologies available to them and that building blocks approach so that they can still thrive within their abilities. And then coexisting mental health and alcohol drugs. So we know that people who are facing alcohol and drug use face barriers to accessing mental health support. That's a national problem, but really working with local partners to ensure that pathway is more seamless. And then you'll see at the end, we've got some clear targets in terms of outcomes, in terms of what we're trying to achieve. But obviously, a big part of that will also be considering the qualitative insights as well. So it was a bit of a whistle stop, but yeah, it's just to kind of seek board's approval for the publication of that so that we can continue with that work locally. Happy to take any questions. And I should say I brought Anna Thompson along with me as well in our team, who's been instrumental in supporting this work.
Hi there, Ben Riley, Chief Medical Officer at Bob ICB. Thanks very much for the report. So I did have a bit of a look at the national data after I saw that statistic about 38% of 15-year-olds drinking more than 15 units a week, because it sort of jumped out. And I wonder if there might, on the national data, it's about 31% of 15-year-olds who had a drink in the last week were drinking 15 more units a week. And I wonder if it might be worth just checking the stat, because that would sort of fit more with the data there, whether it's 28% of 15-year-olds who had a drink. Yes, and nationally about 16% of 15-year-olds drink a week, so that would make the overall about 5% of 15-year-olds. But that's still, I would say, still a shocking, but it feels a bit more believable maybe than 38% of them drinking that, because that's a really, I mean, that's the maximum weekly recommended amount for adults. So it just might be worth checking out that statistic.
Yeah, we can check that. I don't know, Anna, if you've got an answer to that, but if not, we can check it.
Great, thank you.
Crew.
Thank you. So I went to one of the workshops that was held in preparation for this, which dealt with children and young people, and it's good to see that reflected in what's come out. There are some things in here which I'm quite interested in. I'm fascinated as a council. We don't actually know who sells alcohol and cigarettes in the borough. We just don't know, and we must have a list somewhere because they're all licensed premises and so on. But we don't know. And that seems to be a fairly simple thing to fix.
Yeah.
Well, I hope it is. But the other thing I found very interesting was that the relationship between vaping and smoking is quite complicated, and that whereas people generally seem to think, well, people vape in order to avoid smoking. Actually, some people think vaping is worse than smoking, and other people have thought that smoking is worse than vaping. But there's a big crossover, and they don't all do one exclusively. That makes it quite difficult to tackle. But I wondered if you had thought about the impact of this. I think they're doing away with that single-use vapes and things like that. What kind of impact that might have on how people interact with it? Because in my mind, the thing that makes vaping so attractive to younger people is the vast number of flavours. I mean, if they could do away with some of that, that might be a bit better.
Yeah. So, thank you, Prue. So in fact, to your first question, yes, I can be reassured that we are already working with licensing colleagues to get that data picture. So I think it's just been a factor of asking the right questions and then sharing and utilising that data. So we will have that soon, hopefully. And then in terms of vaping, so in terms of the national policy around smoke-free generation, there is ambitions to think about how that is licensed and sold and made attractive to young people in particular. So there are ambitions to make that less desirable. While we await that policy, I think we've got to think about what we can do to educate and inform young people in particular locally. And we've been doing our HUPT kind of drama workshops across all the secondary schools, which has been really well received. It's kind of a theatre dramatic group, and they talk really conducively with school pupils in a way, senior authority figures can't. So we've had really good feedback from people about that. In terms of, so we did some insights piece of work, so speaking to people in routine and manual occupations, and absolutely it came out really strongly that cigarettes, vaping, it's all seen as the same addiction and part of the same problem. Often they would start vaping and it'd lead into smoking cigarettes, and they'd be in this kind of dual cycle. They didn't see it as the harm reduction tool that national policy indicates. They saw it as very interchangeable and part of the problem. So I think now we've really got to think about how that's the group we now need to support locally. They are our smokers, as long with people with long-term mental health, and really think about creative ways to support them. And some of that can be short quits. Sometimes it's just reducing the amount of cigarettes or the vaping they're doing, and just finding that kind of harm reduction methodology to support them until they're ready to fully quit.
Stephen.
I wonder whether you could help me, Karen, with on page 44, it's table or figure 18. There's a slight, it looks, I've tried to read all of the text to see what the explanation for this rather startling graph is, but I don't think I've got my head around it. I mean, how do we explain that seeming meteoric rise in the number of smokers that have successfully quit in 4 weeks? Can you see where I mean?
No, page 44, and I've got it. I think it must be different. Do you say figure 30?
Figure 18.
Figure 18.
It's actually 28 of the report. It's 44 of the agenda. Sorry, I gave you the wrong page reference.
That's okay. Let me find it, and then I can make sure I'm saying the right thing. So is it the second figure on that? Yeah, okay, got it. Yes.
It's the line that goes up at a very steep angle. Yeah.
So my only thought, and Anna, do come in, if that was related to COVID, But then you're right, there is this stark increase there. So let us check it again, and then we can make sure that it's correct and you're
It may
cited on
be
that.
that we lack the data. I mean, it looks as though you lack the data for a
Yeah.
period, and then perhaps it's just adding all the data together and assuming it's all happened in 1 year.
Yeah.
But
Yeah, let me check
it
it.
looks just totally counterintuitive.
Yeah, agree. Let me check.
Thank you.
Thank you.
Thank you. Susan.
Thank you very much. Thanks very much for the presentation. I just wanted to ask about the drug and alcohol treatment side of things, that there will only ever be a maximum number of people that we can put through treatment in terms of, or who are happy to go through treatment in terms of the resource available. And I wanted to ask a question about, are the people that are accessing treatment the same people that in our area who are experiencing health inequalities that we've talked about? Something about, you know, are the people that have maybe multiple things going on accessing the treatment? How do we
Yeah.
really understand the who's accessing the treatment? This was a question that I've got.
Yeah. So I think our provider would be able to have an idea, but I don't think we have a concrete answer to it yet. So I know we're linked into, because I came up at CLT, didn't it, Susan? So we're linked into Caroline Markey's doing the children in needs data to start thinking about how we can get a data picture. So essentially, the drug and alcohol service will know who's done the referral, but they don't know about any other touch points in the system. So we've got to improve that picture. So if they're under adult safeguarding, for example, then we will get informed and Cranston will know. So it's led by other partners, but it's all a bit ad hoc at the moment.
Okay, because I'm thinking about how we maximise the
Yeah.
impact when we've got an individual going through treatment, and maybe how we address others, help working with the individual, how we can help address other things at the same time.
Yeah, completely agree. So, for example, if someone's seeking a detox or rehabilitation support, as part of that, we absolutely have a multidisciplinary team meeting where other partners would come in and be part of that decision making. But more importantly, thinking about how they support them on the recovery when they come out of detox and rehab, because that anyone who goes through that type of treatment will absolutely have touch points on the other parts of the system. So that bit is done jointly, but I think we need to get better at recording it and thinking about more broadly what that data picture looks like, and think a little bit more before we need to use expensive treatment options.
I think Caroline say something.
Thank you. Just to add, we're also working with the provider to try and understand better the demographics of people who are going through the system, so to really improve that data collection from the provider side. Okay. So that will help. And then linking better with the new co-occurring substance and mental health programme to sort of look at the complexity of multiple compound need in terms of how people are accessing those pathways, which used to be, and often still are, blockers and barriers to accessing treatment. You know, it's difficult to access drug and alcohol treatment if you're presenting with a mental health issue and vice versa. And so there's lots of work on the pathways to try and improve that. I mean, it's kind of early-ish days in that because of the pressures on the system, but I think that's something that we're taking.
Okay, thank you.
Stephen.
Thank you. I just wanted to very quickly come back and say that the report as a whole, and particularly from page 45 onwards, really confirms, I suppose, what we know, the importance of the building blocks of health, and reinforces the need to carry on all the work we're doing on Marmot, because I was really struck by the linkages between poor quality housing and drug and alcohol abuse in particular. I mean, it's instinctively one would expect to see that, but when you see the statistics there demonstrating what the linkage is, it just reinforces the sense that we do need to, as a council, do everything we can to address these building blocks. And my own area, housing, We're certainly trying to, but it's quite a big task. Getting enough high quality, safe, secure, warm, cheap to live in homes that reduce people's mental pressures, which are the things that lead to drug and alcohol reliance, I think. Okay, so thank you very much for all of that data. It was very helpful.
I think that's everyone, Karen. Yes, and thank you very much. I mean, I found it a fascinating report, and almost having something which you know when someone suffered, it makes it more pertinent to you because of that. So, you know, thank you very much. And it is something which we need to go on working on as much as we can. So that's important. Oh, sorry. Yes. And we had forgotten we've got our recommendations are to note and approve the strategy, to note and approve the needs assessment. So if I propose that, we'll go second. All those in favour? Okay. Thank you very much. Got carried away, almost forgot that. Anyway, thank you very much, Karen.
Thank you all. Thanks for your feedback. Bye-bye.
Bye. So we've got the community safety and serious violence strategy, and I believe Jason is doing this.
Thank you, Chair. If you bear with me, I'll just share my screen. You see that okay? There we are. I can see it on your screen from mine. So this is a slightly different slide deck to what you might have received in your pack, so apologies. We just wanted to update on some quite dynamic changes that are relevant to what we're trying to achieve. Just to remind ourselves, so the community safety partnerships were introduced by the Crime and Disorder Act of 1998, and there are a number of responsible authorities that are required to work together: the police, fire, health, probation, and ourselves among them. One of those activities includes the publication of a strategy, and our existing strategy has run until 2025. We've made a decision that we'll extend that till 2026, which I'll explain the reasons for that shortly. So today I'm going to talk to you about what will in effect be a strategy from 2026 to 2031 or thereabouts. So the strategy extension just gives us a little bit of leeway to take our time, do this the right way, make sure that all perspectives are reflected and that this aligns with a number of other strategies. So some of what Karen has spoken about, the CSP has already heard about, and we'll be thinking quite seriously about the alignment, but there'll be a number of other issues. But it's about the engagement with communities first and foremost, and wider stakeholders, just to make sure that the CSP is fit for purpose in terms of its strategic priorities, and that those priorities align with where our communities are at in terms of what's important to them, what issues are that they feel keep them safe or less safe in the Wokingham Borough. I mentioned the alignment with long-term planning. So the council plan, which exists at that highest level. So in terms of the hierarchy of strategies, if you like, the hierarchy of priorities, we want to make sure the CSP works in tandem with the council plan. It's not something that's working at cross purposes with the council plan. So working into that period of 2030, 2031, we think actually having an extended plan. Previously, it was a strategy, apologies. Previously, it was proposed to be 3 years. So this would in effect create a 5 to 6 year strategy, depending on the points of review in that timeline. So we want full and meaningful engagement, and that isn't just about at the start of the strategy, but it's about coming back to residents' views, partners' views, so that that strategy is a very dynamic document that on an annual basis we will come back to, so that we can make sure that we aren't just reflecting a point in time in 2026, but that actually in 2027, 2028 and so on, we can respond to some of the more dynamic issues that might be going on, as well as any challenges or opportunities that come our way from central government. We've heard today about the future status of PCCs, for example. So things happen very quickly in terms of what and where we take our direction. And it's about fostering cross-sector collaboration. So it's looking beyond just those responsible authorities, thinking about the voluntary sector more deeply. So since I've come into post, we've already had lots of conversations with different stakeholders working in the charitable sector, the faith sector, about their role, tackling issues such as hate crime, support to communities, concerns that users of their services will have about safety, but also thinking about prevention. So prevention is the key to everything. The more we can do to keep Wokingham a safe borough and a place that people want to live in because it's safe, that's all good. This is quite a busy slide, but I'll just sort of give you the headline. So we have an engagement plan. So from this period into spring of 2026, we want to take our time to really land this strategy very well. I think it's fair to say that the strategy document that we had produced was very long. It reflected all sorts of preferences and priorities that people wanted it to reflect, but as a consequence, it became a very burdensome document. So we pared it back. We've come up with some very clear priorities that will align with other strategic plans. And we want to test that with first our communities and residents. So engaging with them, hearing their voices, understanding from them what the key issues are. Children and young people, so youth and organisations. So bringing children into the problem solving space so that actually we're hearing what is on their mind, that some of the things that we as adults make decisions on are set as the priorities that don't necessarily align with where children are at and what they're experiencing. And that includes in the online space, it's worth saying. The CSP itself, so the partners within the CSP and around the CSP, so other strategic forums, volunteers associated with different groups working in Wokingham, and businesses and council staff. So business is very important in this. The CSPs have an obligation to be thinking seriously about business crime, but how businesses are impacted by crime. Shoplifting is the obvious example, but there are other features of the sort of the business experience that we need to think about, particularly cybercrime in this modern day. And then the things that we're going to engage on. So the community safety priorities themselves, what are the key themes and how will they enhance safety within the community? Stakeholder collaboration, so engaging stakeholders to co-produce solutions. So looking beyond the strategy itself, thinking about action planning, actually how do we achieve what we set out to do? So that's about the ongoing work that the CSP needs to do. So it isn't just a meeting that comes together and we review data and we discuss plans, but actually there's activity that goes on between those meetings, and that activity is meaningful for our stakeholders. Feedback for strategy development, so that's about where we are, but also the ongoing changes in the community psyche. So some of that's about perceptions and reactions to events that can raise the fear of crime, but some of it's about the reality of what people are experiencing that as partners we're not necessarily tuned in with. So the intelligence from communities is really important, and that might influence whether or not the strategy adjusts or we amend some of the priorities to reflect that. And then key engagement topics. So what do the public need to hear about? What do they want to talk to us about in terms of crime prevention, safety, particularly for children and young people, the public spaces and how they're managed, and interagency collaboration. And there's so many subsets of this that we could get into. We don't have time, but domestic abuse, counter-terrorism, online safety. There's so many facets of the CSP that it's quite a substantial piece of work. So how we're going to do the engagement. So we're going to be using our Engage platform. We recently had a very successful consultation for our public spaces protection order. So we know that that's an effective tool for engaging the community. Not all, or not everybody's online, and we're very aware of that, but it's a good tool to engage those that have the means and are willing to interact with us in that way. Wokingham Borough Council newsletters that we send by emails to various stakeholder groups. We will be using some paid social media just to get this out there and make sure that we elevate the interest and the interactions with this on social media. And we've already seen some good examples of that recently. There's community social media as well, so using the platforms that stakeholders have to help us elevate and communicate the strategy and the consultation. News releases, focus groups and workshops. So some of that will be talking expressly about the strategy, but also some of that will be talking about themes that either come out of the strategy or we hope a strategy would reflect. So, for example, I attended workshops with members of CLASP last week just to hear their views and perspectives about what's on their mind, what they worry about, what they feel helps them feel safe. all of which is relevant in terms of how we do this. And then presentations and discussions with partners and at community events. So where we can have a platform and we can contribute and discuss these themes, we will do that. So these are the priorities. So the what. So part of the consultation is to ask stakeholders in the community whether they agree with the themes and priorities. Are we missing anything? And how do you see these priorities being delivered in your area? So these have adjusted slightly in working with our adult social care colleagues and thinking about the CSP's relationship with the adults board and a new structure that will bring those things together. Where we can combine and share priorities, we think that's worth doing, particularly where the common theme is vulnerability, or the vulnerability of our community. So using language that's common to both is our ideal. But then there are some very specific community safety themes that you'd expect to see. So addressing crime and antisocial behaviour and focusing on hotspot locations, working with all stakeholders to reduce the risk of abuse and neglect, and protect the community from threat, risk and harm. So that's the one that's been adjusted to reflect some of the adult social care priorities and principles. Reduce the prevalence and harm from domestic abuse and violence against women and girls. So that reflects a continuum of harm that arguably is probably the single biggest threat to our communities, that is understated in many respects, hidden in many others, but nevertheless needs our forensic focus to make sure that we're looking at this from, you know, unhealthy relationships in school settings right through to violence expressed in abusive relationships in domestic settings, as well as in the community. Tackling serious violence, including weapon crime. So our hypothesis is in Wokingham, a vast proportion of this is actually domestic abuse and violence against women and girls, but we don't want to be complacent about that. But it's just making sure that we don't catastrophize and unnecessarily raise concerns about issues that may not impact Wokingham in the same way as other places, but nevertheless an unrelenting focus on prevention. So thinking about how we achieve that, particularly with children and young people, but other vulnerable groups that may be at risk of becoming victimised. This one links into Karen and Anna's presentation somewhat. So preventing crime and reoffending that is associated with alcohol and drug use. This is one that probably is the visible element of crime that communities experience and is often associated with other things such as shoplifting, but also violence in nighttime venues and so on, but also erodes some of that safety net that families provide, where alcohol or drug misuse is impacting on their ability to care for themselves and each other. So you heard some of that in the previous presentation. And then raising awareness of the dangers and impact of the digital world. So this is one I'm particularly interested in. I think none of us in this call can claim to have lived in a world where we grew up with digital means. It's certainly a ever-present feature for children, but it's more and more an ever-present feature for older people at risk of online fraud, and all communities really trying to navigate a world that once you're in that online space, those protections are so important, and we're not necessarily navigating that space in the same way as a criminal justice system. So this is our timeline. So we're currently in an informal survey phase. So this is where we've been developing the survey. So the survey is currently out for consultation online, and then we will constantly come back to the outputs, the inputs and the outputs that we receive from that. We'll shape a draft action plan and amend the strategy in response to that consultation. So that will start in January, and then we will consult some more on the outputs from that. So the action plan and that refinement from February onwards. So that's where we will start doing workshops with target groups. Then we move into an engagement phase where it's a little bit more about you said we did. So it's translating what stakeholders in the community have told us they want to see happen into action that will be expressed through an action plan that we hope can be endorsed through our governance structures and the CSP itself, CLT and executive board and so on. And then post-election, the strategy will be launched. So we're giving ourselves a little bit of breathing room to do this well and do it right. But each year we want to come back to a review of that action plan so that we're not coming to a point at the end of a strategy where we're wondering where we came from and where we are. We're constantly checking in on that. And there will be various forums that we will do some of that deep dive work just to make sure that we're on track, whilst always responding to any dynamic risks that might occur in a particular part of Wokingham, if not the whole of Wokingham. And this is the final slide. So I will send this around afterwards to Madeline. It's currently online. So off the top of my head, I can't remember when that consultation ends, but it will be running between now and the end of December for sure. So thank you very much.
Thank you very much, Jason. We've got any questions? Prue?
Yes. I don't have any problem with your list of priority things, but I do have an issue with the way they're worded, because apart from the word girls, children don't feature in them, and particularly the last one, the digital side of it. Yes, there are lots of elderly people who are at risk from digital harm, but children are at risk. Are they? Yeah, but they weren't on his slides. So I was going by your slides. It may be in the paper, but it is really important that the type of harm that children can get online is quite different. It's not the fraud. It's actually sexual exploitation. It can even lead to suicide, and those kind of things, being sucked into very right-wing things and all that kind of thing. So I'd really like to see that, but also the domestic abuse side, that children are victims of domestic abuse in their own rights now, and we need to make sure that that is really reflected. I'm sure you would reflect that, but I'd like to see us making that more obvious. And I'm glad you've got young people in your consultation thing. I'm sure they will feedback vociferously, because they normally do.
Really helpful points. Councillor Conway, Councillor Tiblin and I are at a summit with children next week, actually. So led by Reading, but we're hoping to replicate some of the features of that work in Wokingham moving forward. So looking at our own Young Voices programme. I know within Children's Services and thinking about the Berkshire West Safeguarding Children's Partnership, children and domestic abuse is a high level priority. So we're also working on that. And this comes back to the point of actually how can we refine and shape this to the point that actually we've got priorities that reflect where everybody's at, and not having different strategies with different language, I think is really important. So I will take that on board. And as I say, if councillors would appreciate one-to-ones or group meetings as part of this conversation, we're happy for that. Or, feel free to take part in the online consultation. In terms of older people, I think we've got a lot to do to just make sure that we're thinking about all of the type of crimes that they experience, particularly where the crime data doesn't necessarily reflect levels of underreporting. And that would also be a feature for children, because, of course, they're not likely to pick up the phone and call 101 if they experience something in the park or public space or even in the family. So there's a reality to what the data tells us about what the priorities might be, but actually within some of the casework and some of the issues that come through, certainly your inboxes as well as the actual activity within statutory services, we've got to be mindful that Wokingham is a safe borough, but there are things that people experience that are not okay, and we've got to reflect that.
Can I just come back quickly, David, on that point before you bring Stephen in? Yesterday I had to go up to London, and I was sitting at the station waiting for the train, and there were some sixth formers who were going on a school trip. I think they were sixth formers. They looked like about that age. And two of them were talking and sitting next to me, and one said to the other one, "Are you all right?" And she said, "Yes, but I was nearly kidnapped on the way here." And he said, "What do you mean?" And he said, this Jamaican woman approached me and said, "I've got a job for you, get in the car." And she said, "I ran." But she's not reporting it to anybody, not doing anything with it. And somehow we need to capture that, because I'm sure that she's not the only person who's getting this. I don't know what the job was, whether it's what sort of child exploitation it is. I mean, it could be county lines, it could be sexual exploitation, it could be anything, or it could be her overreacting to something. But it really worried that this is going on and we don't get it recorded. So the recording of stuff is really important.
Yeah, I think to some extent we can capture some of that through perception surveys and the like. But you're right. I think we've probably all had. I mean, I've had a similar experience recently, who do we tell about that is a real challenge. Certainly, only this week we've had conversations with our Thames Valley Police colleagues about safety on public transport that children and adults with learning disability have raised with us as a bit of a theme. So what can we do to work with Reading Buses, British Transport Police, Network Rail and so on to look at that? We'll certainly be taking that on.
Sorry, Rebecca.
Thank you. Jason, I was interested in you saying about talking with stakeholders and engaging with stakeholders. And I'm pretty sure you mean all the local voluntary groups as well, because they have some real key information. They really know what's going on, the nitty-gritty as such, and they're meeting with people every day, supporting them in the voluntary sector. So I wondered if you could just kind of go into that in a bit more depth, what you're actually doing to kind of work with those groups that are doing a lot of things for us without us really realising.
Yeah, absolutely. As I mentioned, we took part in workshops with CLASP last week, so meeting with users of their services to understand, both young and old, to understand their perspectives. Only today reached out to Age Concern because they came on one of our staff events, so that was a great opportunity to make that connection. I've been to meetings that Nick chairs, so we're exploring all of that. We're also going to be working with our community engagement team to use the community action participatory research method to build and strengthen those relationships, so that we're not working at cross purposes, but we're working with the relationships that exist, as well as developing some of our own. So we have some quite strong relationships with services providing support to children and young people, for example. So any and every, I've made connections with colleagues involved in terms of interfaith work that I've had experience of. So any and everything we can do to really solidify and elevate their voice, that's our mission.
Yeah, and they can provide you with so much useful information
Absolutely.
as well, because
Absolutely.
they really do know what's going on. And I've been amazed being involved with the voluntary sector about how many charities there are out there in Wokingham that are working and looking at specifically these kind of different needs. And they might be small groups, but they really are making a massive impact.
Absolutely. And it's that authentic intelligence that
Yeah.
it's not expressed in a spreadsheet because somebody reported it to the
Yeah.
police. It's actually, this is what I experienced, but I don't feel I can tell you, and these are the reasons.
Yeah, and it's getting them to respond to your survey as well. That's another
Yeah.
thing, and getting the information from them, because a lot of they're obviously all run voluntary as well. But
Yeah.
thank you for that, Jason.
Thank you. Thanks, Stephen.
Thank you, and thank you, Jason, for the report. I found it very interesting, and just wanted to come back to those priorities. And that last one we were touching on, online fraud, exploitation. I think it's reasonable to say, although I've got no data to back this up, that in a place like Wokingham, where we have relatively little crime, the most likely way in which somebody's going to be affected by crime is through online. It's probably going to be either fraud or exploitation of one description or other, probably mainly fraud. And there, I think we have a really big problem, because particularly in relation to fraud, there will be an enormous reluctance on the part, if it's a minor kind of fraud, it's not life-changing in the sense it wipes out all of your savings, but if it's relatively minor and absorbable, people feel embarrassed about confessing they've been fleeced, and so therefore they don't report it, and the people who do this are able to continue operating with impunity. And I think that is a really difficult thing to actually address, because there is an element of shame and embarrassment at having fallen for one of these cons. And I don't know if there's anything we can do to try and address that in terms of the way. I know there have been some courses that we've been running that are designed to help with this, but I just would welcome any further comments you might be able to give on that.
Thank you, Councillor. Yeah, quite a lot within that. So only this week I've been at an organised crime conference where it's estimated that a minimum of 41% of organised crime is expressed as you described it. So it's those low-level experiences that people absorb, but also people's understanding of what is fraud People have this kind of notion in their mind that somebody's going to steal money from their bank, but it could equally be the rogue builder that turns up, takes your money, and then never fixes your roof. It's all of those things, as well as there's some of the romantic relationship type fraud that goes on, that people secure money through illicit means by pretending that they're in some kind of relationship. So there's a lot to do there. I think from a trading standards point of view, there's some resource that's been commissioned to develop communications and awareness across what we call the local command unit footprint, so West Berkshire, Reading and Wokingham. I'm having conversations, and my colleagues are having conversations with Thames Valley Police about, well, what's the organised crime impact on Wokingham, and what would be the response in the event that somebody did report something such as you describe anyway, and is that sufficient? Because what we don't want is things being deprioritised because it seemed to be relatively trivial, when actually the impact personally or for a family can be massive. I do think there is something about affluence and wealth being a bit of a magnet for criminals, so we need to think about that too. So there's probably things going on at quite a significant level that we don't hear so much about, that people are able to absorb a bit more, but nevertheless, it might be useful to find a way to track that. So quite a lot, and I think alerting people to the risks of what could be fraudulent activity. What was interesting about meeting with CLASP was there were lots of people with different types of learning disability and learning needs, but they were very sophisticated in their understanding of what to do if they felt they were being defrauded. And if we can learn from them and translate that to other groups, they knew they needed to talk to a trusted adult. They knew they needed to tell somebody. They knew they needed to ask. All of the simple things that people often don't do, and we're all prone to it, let's be honest. How peer-to-peer we can support each other, learn and grow, I think it is also something that will be helpful. And what can we do to enable that? Because I'm conscious that Rebecca's point that volunteers, it's their time, they don't get paid. What can we do to make sure that that doesn't come with a cost to them, and so they feel equitable?
Thank you. I think Phil's got a point or a question.
Thank you, Chair. Yeah, it was really just to build on what Jason was just talking about there. And I just wanted to make reference to our Keep Safe month in February, where we have a really great opportunity to bring to light some of the real issues that affect members of the Wokingham Borough community. Last year, we created a Keep Safe campaign, which reached about 600 people across the borough. This year, we're hoping to reach many, many more on all kinds of subject matters, some of which have been covered today. So we look forward to that. We'll work very much in tandem. So the voluntary sector involved will be leading that alongside the community safety strategy to get some of these public messages out, and importantly, give people the tools that can keep them safe into the future. Thank you.
Yeah, and we hope to repeat that year on year. So we had a great meeting, didn't we, Phil, with the CEO of the Ben Kinsella Trust this week, who's going to offer a keyline speaker for that event. So attracting that national interest in our local event is really great for Wokingham. So
thank you, Phil. And I'm sure that one of the things about keeping safe is that everyone reports when negative things, be that fraud or abuse or rape or whatever, happen to them. I've got 3 friends who've told me they've been raped and they haven't reported it. And, you know, and they won't tell me any more than that. And I just think, well, you know, that's so sad, because that person might have gone on to do more and more. And so that's the danger. And yet they said, well, I was too embarrassed and I didn't feel anything would happen. So, you know, it is something that is very real, and something that we must all meet, you know, in our work as well. So thank you. And I think that's the end, Jason. So thank you very much for that.
Thank you, everybody.
Oh, sorry, Susan's come in.
Thank you very much. So, thanks for that, Jason. I think that one of the reasons as well, which you kind of alluded to about this, there has been this extension to the consultation, is that really important that we do engage as deeply as we can, and also we are bringing together the Community Safety Partnership and the Adult Safeguarding Board, which is a real opportunity to work in a very sort of different way and a more joined up way. So I think it's a, you know, is a real opportunity there. I wondered when looking at those priorities about whether we need to say more about community cohesion. Given, you know, you've talked about there has been an explosion in social media, and then of course that has had big ramifications in terms of community cohesion across the country, and it's about how we do properly take account of this development, and really, you know, bring community cohesion as a real plank of this strategy, because it's really important for community resilience as well. So I don't expect an answer now, but I think we really need to think about that. And then also, when Prue was talking about what she heard what you heard, Prue, at the station, about how we really think about how we do encourage, say, young people to come forward with information that they might know that they might not otherwise admit to. Again, don't know the answers, but there's something that maybe we can do with schools. It's because it's that, and then, you know, I think as organisations, say as the police and local authority, when we act and think in terms of thresholds, and there are and often the things that don't reach the thresholds, actually, when those points are joined together across organisations, they tell us a lot, and we can do a lot of prevention work. So it's about how we, and again, it's a big issue, but how we think about those matters that don't reach our thresholds, that can help us actually do more prevention work.
Yeah, I mean, I think you know my views about criteria-led decision-making, but also when do we catastrophize and therefore raise the fear of crime? But when are we complacent? So when do we say too often it won't happen in Wokingham, but we've got no evidence that it won't happen in Wokingham other than it never has, but it might. So yeah, it's really changing the mindset to be thinking about what works well, but also what are we not thinking about, or what are we not looking at simply because it doesn't feature in, as you say, thresholds or criteria, data sets.
Sorry to come back, but I wanted first of all to say, you know, there is always going to be a hidden figure of crime. We're never going to be able to get to the level of 100% reporting, because there are a whole variety of reasons why people don't report crime. Historically, one of the challenges, particularly for sexual offences, has been the assumption of an unsympathetic hearing from the police. Now, I'm hoping that is an historic problem, not a current one. I think police have made very considerable efforts to try and deal much more sensitively with reports of sexual offences. So, but there may be more work that needs to be done to make that clear, that there will not be a kind of hostile response or a negative response if you report such offences. The other point I wanted to make was really to reinforce what has just been said by Susan about thinking about the dangers of the online world, not just in terms of fraud and exploitation, but incitement to division and breaking up of social cohesion, which can, in the most extreme cases, lead to violence. We've seen that in other parts of the country, thankfully. We haven't really seen anything on a significant scale here, but that doesn't mean we won't. And clearly, social media is quite a significant ingredient in the stoking up of social tensions right now. One hopes that this isn't going to be a permanent shift in the way people operate, but there's abundant evidence, really, of a very much more divisive rhetoric for many years. This isn't just a problem associated with hotels and migration. It goes back at least to the kind of Brexit referendum campaign, where the whole idea of social cohesion was challenged by people online. Now, I don't know how we address this, but I think it is a really quite serious threat to social cohesion. I know the police monitor as best they can comments and try and take action when it's appropriate, but I think we might need to feature that quite explicitly in our priorities.
Yeah, it links to our values, doesn't it? And I think there's something about the response to the echo chamber that we all exist in, and how can we help children in particular critically apply thinking to the information that's in front of them. By the time we get to 2031, we will be in an entirely new reality, won't we, in terms of what's actually the key issues that we won't even be able to anticipate. So I think, yeah, we'll definitely take that on board, I think, and try and reflect that.
Thank you very much, Jason.
I think that's it this time. So thank you very much for that report.
Thank you,
Jason,
everybody.
and for all you're doing. And thank you.
See you again. Thank you very much.
Indeed. Thank you. So now we've got the Bob ICB briefing from Ben. I'm sorry that Fraser's sitting on your toes.
That's right. Keep my feet warm. Yeah, thank you. Yes, so last month from the 1st of October, the Bob ICB and the Frimley ICB began formally working under the collaboration agreement, with the boards forming a joint committee. And the first public meeting of the joint committee is actually next week on Tuesday, the 18th of November. Full details are on the with the board papers are on the Bob ICB website, and you're obviously all very welcome to join that meeting if you'd like to do so. To make sure that the new ICBs can hit, and the Thames Valley ICB can hit the ground running from April, the two ICBs have jointly published some high-level commissioning intentions to cover the next 3 to 5 years based on the priorities in the long-term plan. These outline at a high level how we're aiming to improve health outcomes for people, what health services and pathways will focus on developing as strategic commissioners to reach those objectives, and then where we plan to invest resources to make the biggest difference in that aim. And those outcomes are based on population health data, service performance data, financial analysis, and very importantly, insights gathered from our communities as well. Over the last few years, we've gathered information between the two ICBs from more than 3,800 surveys and survey responses and over 2,000 people, more than 50 focus groups and workshops, which have all fed into that from a wide range of ages, backgrounds and communities. And also, of course, some important and invaluable inputs from Healthwatch and our other organisations locally that have, that amplified the voice of patients and carers in that. The themes coming out of that will probably not surprise you on the committee, because you'll hear this a lot about improving access to services, more preventative health, particularly for long-term conditions linked to obesity and such as cardiovascular disease, diabetes and dementia, and some of the things we've talked about around the wider determinants of health, alcohol, drug use as well. More coordinated care models that consider housing, transport, social care together, as well as children's mental health and development. And then important theme is digitally enabled care as well. Digital tools are increasingly valued and used by people, but we know there's a need for better integration between tools that, for example, cover GP, hospital, social care, pharmacy, so on, and also how we support people who find this way of accessing care more challenging. And there's a relevant update to that I'll come on to in a minute around GP access. And then over the next few months, we'll be working with Healthwatch and community organisations and partners to continue to develop those plans and sort of flesh out the detail, really. If people want to contribute now, they can see those on our engagement platform, which is called Your Voice in Bob, online, where they can find information and also give feedback on the plan so far. just moving on to sort of more operational things, you'll be aware from the news that there's a 5-day resident doctor strike starting from tomorrow. All our trusts have got plans in place to manage this to minimise disruption for patients as much as possible, and we have processes in place that run throughout the strike, continue to monitor safety and respond as needed to industrial action to maintain patient safety. In terms of improving access to GP care this winter, from October, all practices have been required to offer online access to consultations from 8 AM to 6:30 PM. So that's when the practice is open. They have to have those systems up and running all the time. And the aim of that is to, address that long-standing rush for the phones at 8 o'clock in the morning, where everyone tries to get an appointment and then struggles to do so. And also that's available through the NHS app as well. So people can access, GP care that way. That's quite a big change, really, that's come in without a huge amount of sort of media attention, I think, but it's quite a big thing. Also, in terms of prevention for winter, we're pleased to report that our ICB, our system, continues to deliver strong results for the winter vaccination programme for flu and COVID vaccinations when we compare with other systems. Well, I think we were the second highest uptake in the South East region, although this is in the context of reduced uptake in vaccination generally with the public. There's still a lot of scepticism around vaccination that we need to overcome. So it is important we continue to push this message, because this is a really important way that people can protect themselves and their families and vulnerable people in their families over winter. And so that was my update. Happy to take questions.
Thank you, Ben. Anyone have questions? Rebecca.
Hi, I heard this at HOSC as well from oh gosh, sorry, my brain's gone dead. Alice's group, Health Watch, sorry. About how we're looking at trying to get this information from people about how they are, if they're not digitally aware. My concern about it is that a lot of the questionnaires that are going out and the surveys are themselves digital. So they're not going to be reaching those people that this is really a problem for. So do you know how you're going to actually access those people, that the only way they can do things is by the telephone or actually going into surgery? I support a lady. I have to do everything for her. She's not able to do anything online. And those are the people you really need to be talking to, and you're not reaching them with these surveys. They're great surveys, Health Watch, I've seen it, that we were forwarded it, but it's not reaching those people.
Yeah, thank you for that. That's a really important point. And I think, we would definitely be interested in further discussions with Health Watch and other community groups if you have suggestions, because I think you're right, this is a challenge to reach the people that by definition are struggling to engage with that way of communicating. As a commissioning organisation, we're also one step slightly removed from the front line of the service sort of delivery as well. So we also need our provider partners to help flag up these things with us too. But we definitely is an issue we need to to consider, I think. So if you have any further suggestions, we'd be welcome.
I wish I did, apart from doing focus groups, of actually meeting with these people face to face, because believe me, there are a lot of them in the community that are not, and sometimes these are the people as well that are suffering the most health inequalities, and that's the problem. They're not able to access a lot of things. They're not aware of what's going on, and that they are the ones that we should and could be helping. So it's a difficult task, and my concern is, as I've said, that these surveys that are going out, and the one you've just talked about, they are digital. So how are you going to get the truthful information about what you need to do?
Yeah, I'll feed that back to our engagement team, actually.
Thanks.
Thank you. Stephen's got a question.
Thank you. Rebecca makes a very good point, obviously, about digital exclusion and how you reach the difficult to reach people who most need this kind of help. But I was going to think about digital issues from the opposite perspective, which is the digitally very knowing, and go back to that point about declining levels of commitment to vaccination, which is linked again to what people read on social media, which is sort of misinformation, disinformation, and people believing it. And it is quite a profound worry that that when Jason was talking earlier, talked about young people questioning more and you know, interrogating what they're being told and actually trying to work out whether it is plausible or right, rather than just accepting it at face value. But this is a real challenge for us in this area as much as it is in the area we were just talking about under the other in relation to the other item. I don't know how you're trying to counter some of the narratives of vaccination is all some kind of dastardly plot to infect you with all sorts of things. I mean, is there a kind of social media presence designed to try and counter some of this stuff, or is that really just not within your capacity at this stage?
Yeah, that's a really good question. And worryingly, we are seeing this, reduction in healthcare staff as well. So it is having a wider impact. It's not even just access to, as simple as giving people access to the information and then they'll make the decision to have the vaccine, because there are these sort of wider worries, I think, about it now. We have tried a number of things. We've been doing the sort of traditional media, like the radio thing, the press releases, all those sort of messages. We have been doing social media as well. And also through health professionals, try and make sure that, that when people come into contact with patients, that they are sort of getting those messages over. During the pandemic in particular, and, we've continued a little bit, but less so, we have worked with community leaders and religious leaders as well to try to see if we can sort of focus messages on particular groups that are more concerned about vaccination than perhaps other groups, and then also there's the role modelling of staff by encouraging our staff to have the vaccine and as well. So there's sort of different strands that we're working on, but it is a wider challenge, and there's a huge amount in the media, not necessarily helped by very prominent national leaders, not necessarily in the UK, but who don't openly challenge vaccination.
You got a question, Nick, or comment?
Yes, thanks, David. Thanks, Ben, as well. You mentioned in your overview there the doctor surgeries taking on, or you're able to make online appointment bookings now. I'm just quite interested to know what the ICB's role is with enforcing, maybe that's too strong a word, that option, because I've just had a look again at my own surgery within Wokingham, and there's no option through the NHS app unless I want to book a routine smear test or something like that. And on the website, it says that I can book it through an online form, except ones that are available, temporarily unavailable, are booking a new request to see a GP. And it says because there's nothing available. So even for those who are digitally enabled, is this really working? I've heard a lot about the NHS app and how that's supposed to be advancing healthcare and whatever, but it doesn't seem to be offering what it's supposed to at the moment.
Yes, it is now a contractual requirement for practices to offer this, and yeah, we will obviously this only come in obviously in the last few weeks, but we will be monitoring and following that up, and then working with any practices that are not offering that consistently, and to understand what the issue is. It has been quite an adjustment. It came quite there was some controversy, I think it'd be fair to say, around how it was sort of introduced and got agreed nationally, and slightly caught, I think, the practices by surprise and into how it was sort of agreed. And we are aware there are a small number of practices that aren't necessarily, meeting the obligation at the moment. So we are going to work with those practices too. But it will be, our job as an ICB, at least for the time being, to follow that up and make sure that they are delivering against the contract. So yeah, we will be looking at that.
Thank you, Nick. Susan.
Thanks very much, and thanks, Ben, for the overview there. I think I probably just wanted to raise a number of points. So on the high-level commissioning intentions, I think that as local authorities, probably we need more meaningful engagement on that. I know there was an issue because the deadline that government set to actually formulate the commissioning intentions to start with was really short.
Yeah.
But I think we need to have more, the ICB needs to have more meaningful engagement with local authorities on that, certainly as we move forward. Secondly, I just wanted to make a point about prevention. I know the ICB talks about prevention, you've talked about prevention, yet when we look at the NHS strategy and the priorities, and they've recently been talked about, there are a lot around reducing waiting times, for example, around the A&E, in the A&E, and also for operations as well. And so there's a real focus on prevention in the sort of acute side, if I can put it like that.
Yeah.
And it's about how we ensure together there's a continued focus on prevention in its broadest sense. I just want to flag that because I think that's a real risk given where the government is in terms of prioritisation. And an area that I wanted to flag is around SEND. So in the last week, Slough have had their area SEND inspection, and it's got wide systemic failures, as identified as wide systemic failures, and so that's now part of the bigger, ICB, and so we know, Oxfordshire had that a period ago. Now we've got this with Slough, so that will include health in terms of the systemic failures, and it's about how we keep together the finger on the pulse in terms of addressing this in the SEND arena, given all of those other factors that I've just mentioned.
Yes, yes, a few points there. No, I mean, I agree about the need for more meaningful engagement with local authorities, and I think Health Watch have made similar points, and in fact, a lot of partners, and it was all done extremely rapidly over the summer with very short notice at a time where organisationally we were a bit challenged as well with all the internal changes happening. But and they are quite high level and deliberately being sort of drafted in a very sort of flexible way. Those high level intentions, so that we can build off them and over the coming months, and with that engagement into meaningful plans. I mean, some of that's already sort of started to happen with things like the neighbourhood health workshops, which is a big part of the intentions. And I know there was a workshop in this area only yesterday on that. So with between local authority and health and other partners. Yes, and I also agree with that, the prevention, that, and this all frequently happens, unfortunately, in the NHS, that there is this inevitable focus on the immediate urgent care, pressure at the expense of long-term health improvement, and we absolutely need to make sure that we don't lose that focus. I am encouraged by the fact there is such a sort of building area of attention on things like obesity and long-term heart disease prevention, and the things we talked about with alcohol and drugs, and that does seem to be getting quite embedded there. But yeah, there is always this pressure to show quick changes to which some of these preventative things do take a little bit longer, so we need to keep that focus. And I think working with the Director of Public Health as well, is an important way to do that. And again, actually, one of the positive things on the we're expecting the neighbourhood health development guidance to come out in the next days or week or two. And for what we're hearing, that is also going to have a focus on prevention of long-term health conditions. And again, so that is hopefully going to reinforce that. It's not all about ED and A&E. Yes, and SEND, I can't really comment on the Slough thing because the way that, it's not currently in my area, but as you say, imminently that will become part of, the Thames Valley ICB as well. But I know that Bucks is having a SEND inspection as well at the moment. So yeah, so we absolutely need to continue to work together on keep all that sort of coordinated. Yeah.
And just to follow up on that, not specifically the slough inspection, but the things that were mentioned in there about have been common themes in inspections up and down the country.
Yeah, definitely.
And I worry about the capacity in the ICB to actually respond, not because you don't want to, but because it's impossible with everything else that's going on. And of course, at the moment, it's really the local authority that has to bear the brunt of the decision and the fact, try and sort things out, and the people point their fingers at the local authority. But in this case, and in a number of other cases, it's health that are jointly responsible. And one of the things that struck me about that report, there was no pathway for children with cerebral palsy. Well, that's not a local authority thing at all. That's entirely a health thing. I've asked the question, do we have one? I don't know if we do. I don't know, it's not going to affect the greatest number of children, but it is an important thing. And I do worry that we're not going to be able to make things better. And we are expecting our SEND inspection within the next few months. So we have a keen interest in working with the ICB to try and make sure that we're on the same page. The individuals concerned that we work with don't have any problem with their commitment, but it's the overall capacity to actually do anything.
I think that's all the questions. Okay, thank you very much. So we now just got to move on to the forward programme. In January, we've got Social Care Futures box, ICP update. Is there anything else we want for January? Okay. Yes, and there's probably more room in the March and May ones.
I wonder if, based on the conversation that we just had on SEND, whether we could have something on SEND in the near future, given like you just said, Prue, we will have an inspection in this area at some point, so in the near future. So it would be good to get a progress on what improvements have been made, and then what the thinking is in the future, given some of the assurance.
Just to back that up, we have got a co-produced SEND strategy which is done with health, and so reporting on how we're doing with that is probably the way to get that on the agenda. Emma's online, I'm sure she'll want to say something about that.
Emma?
I'm noting down but I think that is a good approach in terms of reflecting on the progress of the strategy and the action plan that sits underneath that.
Is March too long to wait for that? Or do we need
January,
to do January?
yeah.
I think I was thinking January is, if at all possible, because we need to get that done. And if we can get it done before they inspect us, that'll look good as well. So, okay. Matt?
Just going back to neighbourhood health plans, we're still awaiting the guidance. We have got a bit of a plan for that plan locally. Can we just put it in as a placeholder to sign off in March? From what I'm hearing, that's the timescale that will be set for us. So it's just worth putting that in, and then more detail to come.
Yeah, that'd be a good thing to have in March. Nick, you've got something?
Yeah, I was going to say, David, I think the plan is for the physical activity strategy to be developed by May. So it might be worth penciling that in and then checking with Karen if that is the deadline or a timescale to work to.
Sorry, if that's done, that might be 14th of May. It would be good to come to that, if all possible. So we'll check with Karen. Thank you. Any other points?
Yes, horrible little picky point, but it's got IBC instead of ICB in March in the agenda.
It is changing a lot, but I don't think it's changing what it is. But Caroline.
I've just looked at my notes from previously, and the physical activity strategy will be due to go to public engagement and stakeholder engagement in May, and then for sign off in the autumn. Right. So we might want to just put it back a little bit.
Yeah, so we'll wait with that one. Okay, thank you all for coming, and have a good evening.